Addiction and Recovery Podcast. Understanding the terms that shape recovery.
Welcome to our podcast segment on addiction, alcohol use, and recovery. Today, we'll explore an important topic that often surfaces in discussions around drinking: the difference between concern about alcohol use and the presence of a serious issue. Before we dive in, please note that this discussion is for educational and reference purposes only. It is not meant to serve as medical, psychological, or professional advice. Many people have experienced moments when they or someone they know feels uneasy about drinking habits. But what does it really mean when a concern arises? It's crucial to understand that a concern does not automatically indicate a serious issue. Rather, it reflects an individual's or an observer's perception of alcohol use, which is distinct from a formal diagnosis or clinical severity. When we talk about concern regarding alcohol, it's important to clarify that this perception can stem from various factors. Perhaps it's influenced by social norms, personal comfort levels, or observations made by friends or family. This means that while someone may feel concerned about drinking, it doesn't necessarily imply that there is a problematic history of alcohol use, or that specific interventions are required. A common misunderstanding is the belief that any concern about drinking equates to addiction. This is not necessarily true. Concern can arise for many reasons, and the levels of alcohol consumption and their effects can vary over time. Just because someone expresses concern doesn't mean it's a definitive warning sign indicating future severe problems. In everyday contexts, a concern about drinking usually indicates that someone has noticed certain aspects of alcohol use. This could relate to how often someone drinks, how much they consume, or behaviors associated with drinking. It's simply an observation or thought rather than a medical classification. The source of this concern might differ. It could come from self-reflection or from the observations of family, friends, or even employers. Each source carries a different context that guides the concern. However, it's important to recognize that this perception does not quantify a risk or establish a diagnosis. It merely notes that something related to drinking has been flagged by someone observing it. Additionally, it's essential to emphasize what concern does not mean. It does not imply that a medical professional has evaluated the drinking behavior or that a clinical diagnosis has been made. It also does not include an assessment of psychological dependence or an evaluation of physical health impacts. The presence of concern is separate from the necessity of action. Understanding these nuances is vital, especially for those in recovery communities and for those supporting individuals navigating their alcohol use. It can foster a more compassionate and informed dialogue about alcohol and behavior. For those exploring careers in substance use disorder counseling or behavioral health, grasping these concepts may help prepare you for future discussions and interventions. Topics like this are often explored in addiction counseling education. Programs such as those offered at InterCoast colleges include discussions about behavioral health and recovery support. If you'd like to learn more about education pathways in this field, you can visit intercoast.edu. Thank you for joining us today.
If you or someone you care about is struggling with mental health or substance use, help is available. You can contact the SAMHSA National Helpline at 1-800-662-HELP. Available 24 hours a day, 7 days a week, free and confidential, in both English and Spanish. You can also call or text 988 to reach the Suicide and Crisis Lifeline anytime. And if you're looking for treatment or support services near you, simply text your 5-digit zip code to 435748. That's HELP for you to receive local resources. Reaching out is often the first step toward recovery, and support is available whenever you're ready.